Okay, great. Welcome to the third meeting of the Kansas COVID Vaccine Equity Task Force, and thank you all for your continued time and energy in support of vaccine equity. I'm Jimena Garcia. Now, I was just saying that I'm really excited about these meetings now because I feel like it's a group of friends that I'm seeing once a month. And before we start, a few housekeeping items that I need to share. So the Kansas COVID Vaccine Equity Task Force operates in compliance with the Kansas Open Meetings Act. Our meeting is being recorded and broadcast live for public viewing on Governor Kelly's YouTube channel, which we provided public notice of prior to today's meeting. During this meeting, we ask that you state your name and title prior to speaking. We also ask that you mute yourselves while not speaking to ensure there is no audio interference. I feel like somebody is not muted. Okay, great. Sorry, I'm trying to see. There we go. Okay, so I'm going to do a quick roll call, and I apologize ahead of time if I miss anybody. And at the end of the roll call, I'll give I'd ask you to say your name if I missed you. So I'll start with Reverend Tony Carter, Martha Gabehart, Nicole Garner,
Here.
Aude, thank you. Aude Negrete, Elaine Johannes,
Here.
Connie Satzler,
Here.
Ed O'Malley,
Here.
Alex Guerrero, John,
Here.
thank you. John Carney,
Here.
Edith Gaines,
Here.
Edith Gaines, thank you. Jennifer Sutherland,
Here.
Chris Howell,
Here.
Janice DeBoer, I'm sorry if I said your name wrong.
Nope, DeBoer here.
Okay. Sorry if I'm repeating. Chris Howell,
Here again.
sorry. Jennifer Sutherland,
Here.
Meng,
I'm here.
Sarah Guillermo,
Here.
Marina Karst,
Here.
Francis Vanderhoff,
Here.
Kelly Summers,
Here.
Mariana Ramirez,
Here.
Sarah Obermeyer,
Here.
Ellen Herman,
Here.
great. Is there anybody that I missed? And if I did, can you just say your name, please?
Problems connected, Virgil Watson.
Sorry, Virgil.
Allison DeGroff.
Do we have anybody else?
Monique Garcia.
Thanks, Monique. Okay. Well, if anyone joins after and is able, please put your name in the chat. So welcome again. The discussion today is centered around the theme of going to where people are. And we have 4 really accomplished people that I'm excited to hear about today. We're going to be hearing about their work and as it relates to going to where people are. Following the presentations, there will be a discussion moderated by our KU facilitators, Vicki and Shirley. Oh my gosh, I'm sorry. Before we get to the presentations, I wanted to share an update of where the state is quickly in terms of vaccination rates in communities of color and vulnerable communities. Thank you. So the first slide is a summary of all COVID vaccinations broken down by race and ethnicity. I don't want to spend a long time on this slide, but I want to just briefly explain. This looks at total vaccinations broken down by race and ethnicity, and the top line is white vaccinations, and then you can see the different races broken down. And I think the big takeaway is, the good news is that we're really catching up in racial and ethnic minorities, especially in the older population. I want to call out that American Indian, the data doesn't look that good because we don't have the IHS data, but it actually is very good. And so for older racial and ethnic minorities, things are looking a lot better and continue, really over the last 2 months have improved a lot. But where we're focusing our efforts now is in the younger population, because that's an area where we can see that there's still work to do. So if you could go to the next slide, please. In terms of youth vaccinations, vaccination numbers are looking really good, and these just started, but they're really, really ramping up every week across all populations. So this looks really promising, and we're going to continue to follow that. Next slide, please. So this is something that I think is really related to what we're talking about today. So this is over the past 4 weeks, how vaccinations have basically stagnated in really across all racial and ethnic groups. The silver lining in it is that the racial and ethnic minorities are still growing at a faster pace every week than white vaccinations, but really across all races and ethnicities, it's stagnated. And so I think that we're really not going to be able to wait for people to come to the vaccine. We have to think of new and innovative ways to get the vaccine to people. So that's kind of in keeping with our theme today, which is going to where people are in Kansas. And so I'm pretty excited to hear from our speakers, because I'm hoping that a lot of the solution to this issue right here is rooted in some information that they'll be able to share with us. So we have 3 different groups that we're hearing from, and we're going to start out with Reverend Tony Carter Jr. and Broderick Crawford. And I'm going to give an abbreviated bio of everybody, because just for time's sake, but we'll include the full bio in the materials that we'll send out. So Reverend Tony Carter Jr. is the senior pastor at the Salem Missionary Baptist Church in Kansas City, Kansas, where he has served for the past 19 years. Pastor Carter has served in various roles in the Kaw Valley District Association, Missionary Baptist State Convention of Kansas. He serves as chairman of the KCK Dr. Martin Luther King Jr. Holiday Celebration, as chairman of the Mayor's Law Enforcement Advisory Board, and as a member of the Mayor's Task Force for Community Policing. He also serves as a member of the Wyandotte County Health Equity Task Force and as a community consultant for the RAD-X UP grant. He loves serving his community and does so on a regular basis. Joining him in the presentation is Broderick Crawford, who is president of the NBC Community Development Corporation, which was created as an outreach arm of the New Bethel Church of Wyandotte County, Kansas City, Kansas. Broderick is a member of the KU Cancer Center's Patient and Investigator Voices Organizing Together, or PIVOT, patient leadership team. He advocates for consumers through formal, local, and national leadership roles. Broderick currently serves on the Wyandotte County Health Equity Task Force and the KUMC Diversity, Equity, and Inclusion Cabinet. He also chairs the KU Cancer Center Advisory Committee and is the first community principal investigator for the RAD-X UP grant at KUMC. Over to you now, Reverend Carter and Broderick.
Good morning or good afternoon to everyone. Vicki just posed a question. I'm good rolling, and I am. And hopefully my brother will be along real soon. Vicki, if you would put the screen up, we'll get right into this. We're talking about things that we've done to make sure that we're reaching the underserved populations or populations that have historically been excluded in our communities. And one of the things that we did, I think, was key, and Broderick has listed a lot of this, development of the Health Equity Task Force, which includes clinical people from the community, civic individuals, and faith partners. And that collaboration has worked really, really well, particularly in Wyandotte County, but we've also, as it relates to the RADx UP grant, been able to make application of this in 9 other counties throughout the state. One of the things that we did that was key, as you look on the board here, is we identified zip codes based on the number of positive tests, and we focused our efforts in those places. And that meant we had to provide pop-up testing in places where the people were. We had churches, library parking lots, Kansas City, Kansas Community College. We used their parking lot, and we just used the areas where the people were most negatively impacted. And that worked very well for us. One of the initiatives that we've taken is we had what we would call the flagship faith initiative, whereby we had some of the churches who were very helpful to us as it relates to setting up pop-up testing at their churches. And those churches were encouraged to chronicle and catalog the number of persons in their congregations that were vaccinated. And those churches also were encouraged to include 5 other churches in the general area and have them chronicle and catalog their people as well. This was incentivized by using funds from a flagship grant, and each of those churches that participated were compensated for their efforts. And so we were able to chronicle and catalog the number of generally African Americans in our churches, but we also had that initiative in the refugee and immigrant populations as the executive director for Bethel Neighborhood Center, Mong Sono, who I hope is on this call as well, also led that group and churches out of those populations, and they were used in the flagship initiative as well. We also wanted to include the Hispanic community, and it was a little more difficult finding pastors who would spearhead that effort. We're still working on that and hoping that we're also going to have some inroads there. One of the other things we did was we conducted outreach through faith community to get their buy-in as it relates to the importance of testing and support for church leadership for testing. I, from my pulpit each Sunday, use a segment of time either before or after the sermon to talk about how important it is that we are tested on a regular basis and the connection between testing and vaccinations, and making sure that we monitor and encourage people to both of those. We've also engaged ecumenical group that strategizes for getting credible information into the community. So we work with the churches and work with the pastors to make sure that they get that information out to the people.
Pastor Carter,
yes.
If I could.
Yes, Broderick,
also,
thank you.
Also, well, yeah, one, I apologize for being late, but unfortunately, one of our members' daughters was just found murdered. So we still have to deal with challenges as we continue to move forward. But what I'd like for you to also talk about the ecumenical group and how you have different pastors like Pastor Turner, Pastor Brady, Pastor Rowan, Monsana, and how you all are a ecumenical group, but yet you will still be, you're able to come together as it related to us putting together strategies for how we move forward.
Thank you, Broderick. Be glad to talk about the specifics of that. And what we did was we used churches, irregardless of their denominational thrust. We worked again across ecumenical lines to make sure that we included populations where they were most impacted. That was in the African American community. We made efforts in the Latinx community. We tried as well to reach people who were affected negatively by a lot of different things. But those churches, and we have several of those churches, First Baptist, 5th in Nebraska, First Baptist on Quindaro, Oak Ridge Baptist Church, Salem, New Bethel, the Bethel Neighborhood Center, and there were others that worked with us. Some of the cohort churches included the Rising Star Baptist Church, Greater Jerusalem, Forest Grove Baptist Church. I mean, there are just a number of churches throughout our community, but in the areas where they were it was heavily African American and Latino and the immigrant populations, we tried to utilize all of those churches to kind of lead out in front to do that. Broderick, anything I left out?
No, sir. No, sir. We can go to the next slide. Next slide. So here's an example of where we're actually doing work in the community. We utilized funds that were available. We were successful in getting funds from the CARES Act. Here in the greater metropolitan area, we had what's called the Rapid Response Fund. And then I'm fortunate enough to be the first community principal investigator on a major NIH grant that was awarded to KU Frontiers. But one of the things that I think was most significant about our success is the collaboration we had with all of our partners. So with the clinicians and providers from the health department and the different health department teams, our multiple community organizations that are involved, and then our faith-based organization. We have now formed a team to the point where we now have 5 different meetings during the course of the week where we pull together and develop strategies that then we report out to the larger team. That is so imperative because you have folks with different type of views, different type of ideas, different type of strategies, but we all had to put the name on the building down in order to get the work done because of the impact it was having in our community, and particularly the great negative impact it had on our people of color. Lessons learned. So as you see, as we're going through this slide deck, we have pictures of each of us, Pastor Carter and myself, actually in the, as they say, boots on the ground, getting the work done. It was very important for us to be agile and nimble. It's important for us to listen to the voices of the people. Oftentimes we see top-down strategies versus bottom-up strategies. And we've got to understand that in order to make progress, we've got to listen to the people. I guarantee you every neighborhood has a person who looks out the window and sees everything. That's the person we want to touch base with. We looked at every strategy didn't work in every community. We had to make sure that what works for Latinx, what works for African American, what works for refugees, what works for those with disabilities were all brought to bear so we can make sure that we utilize the best method of communication, whether it be radio, flyers, social media. And then the other thing that's so important is that we watch for burnout of our members, because sometimes people can be ugly, sometimes people can be mean, evil. And so our team from time to time got beat up. And so we have to continue to embrace one another when we each go through difficulties and being intentional about embracing and making sure the team is mentally well. And I know we're probably running short of time, but here's one of my favorite pictures with yours truly on the left and my good friend, Pastor Carter, on the right. How can we do more of this? Continue to strategize to what works best at the moment. We went from pop-ups to identified locations to the vaccine centers, and now we're going to different businesses. Continue to engage those people who are at the table, whether they agree with us or not. Everybody's voice should have input. And again, go to those people who are hesitant, go to those people who are fearful to find out what that is. Sometimes it takes a family member, sometimes it takes a pastor, sometimes it takes a clinician or PCP. We've got to make sure that all of those people are available, because you never know which one is going to say something or give input that will turn the tide for those that are in what we call the movable middle.
Oh my gosh, thank you to both of you so much. You know, I just loved seeing that, and I loved that bottom up instead of top down, and listening to the people in their communities. I mean, I really feel like that's going to be the key. So thank you so much. I wanted to also say that we're going to have the 3 presentations, and then following all 3, we're going to have a discussion facilitated by the KU facilitators. So we're going to move next right to Aude Negrete, who is the Executive Director for the Kansas Hispanic and Latino Affairs Commission, and a passionate advocate for social justice, focusing on children's, women's, and immigrants' rights, whose work has taken her throughout the US and Mexico. Aude credits her mother and father for instilling in her a value system that teaches we only win when our community wins. Aude has successfully led and championed state and national legislative advocacy and empowered tenants and asylum seekers to fight for their rights. She has also directed a presidential campaign in Kansas, founded civic engagement organizations for underrepresented constituencies, and advised groups on bridging the gap between their organization and the communities they serve. I'll hand it over to Aude now.
Thank you so much. And first, I would like to point out that I also wrote down in my notes the importance of doing that top to bottom approach. That progress is made when we center those voices of color and go from the top to bottom. And I'm going to try to go really quick because I know our time is limited, so bear with me. So KLAC is a Latino-led organization where the bridge between the governor's office and the Latino community across the state. And the fact that we are Latino-led, I think, has been key to our success. Centering and respecting Latino voices to gather information in the weekly basis and collaborate in solutions with Latino organizations that target issues affecting our community at any given time, and having that rapid response has been really key to our success. Some of the approaches we've taken to solve issues that the Latino community has brought up was Kansas Al Dia, which is a weekly Facebook show about COVID. We noticed that there was a lack of information out there very early on in Spanish. So there was a vacuum and people were filling it with information that was not correct. So by getting local doctors and community leaders to speak directly with the communities across the state each week, we're able to fill that vacuum with information that's correct and through trusted voices. So we have local media personalities, we have local doctors, we have people that the communities trust already, delivering the messages that are true. And we notice that there is a lot of sharing of information, and our views go up significantly from week to week. So we clearly are meeting a need in the community, and that's been very successful. We've also been working on creating culturally relevant and bilingual materials with Latino stakeholders across Kansas. Again, rapid response with the Kansas Health Foundation and other partners. We delivered those materials to meat packing plants, Latino grocery stores, libraries, again, meeting our community where they're at. It might be from town to town is going to be different, but since we have a table where we have Latino organizations from throughout the state, they know their community best, and they're able to help us deliver the materials we create together. We collaborate to create culturally relevant bilingual scripts for Governor Kelly to record with Telemundo, and this is a national Spanish language national network. And they have affiliates across the country. So they're part of our stakeholders that help us record these very professionally. And then we're able to deliver them, and TV stations across the state are running them for free as a PSA. The Hunter Center for Advancing Latino Health has been helping stakeholders in collaboration with KLAC to create weekly graphics that address questions and misconceptions from week to week. So at any given point, we have the needs of the community right there, and then we're able to create the materials they need to get over this pandemic. La Mexicana Radio has been helping KLAC what produce radio PSAs in Spanish for marketing campaigns. La Mexicana is a Spanish language radio station that has a broad footprint in Southwest Kansas, covering Dodge, Garden City, and Liberal, among other communities. So those that we have radio stations running those ads again as PSAs for free, but they're culturally relevant. It speaks to the community, and it's information that's relevant because we're responding to the information we're getting quickly when and know what our community needs to hear in their language with their culture. Publicizing is very important, and it's part of our strategy. As I said, we have these bilingual and culturally relevant materials. However, there's no access. It's impossible to get vaccinated. So advocating for a process that our community can get through has been imperative. More access for people with limited English access, English proficiency, access to vaccines on the weekends, advocating for the meatpacking plants to get vaccines, and bringing up those issues up the chain to make sure that that our community has access to the vaccines. Again, we're statewide, so we haven't gone from door to door as much as we wish, but we will start. And in the meantime, we've been mostly working through this stakeholder group. And we're also, or stakeholders are also putting the flyers and reaching the community at food pantries, food distribution, food pantries at food distribution sites, and other locations that our community frequents. We mostly are serving the underserved, historically excluded, the Latino community, low-income community, immigrant, mixed status families. That means a family that might have some people that are documented or undocumented community, uninsured, underrepresented, and Spanish speaking. So we create the content, and we're also gathering information for people who have several barriers, and we are taking their feelings and their worries into consideration to ensure we're creating this material and also collecting all the information we need. This takes a lot of empathy, and also it takes in living through those experiences as well. So having a table that is made up of Latinos who've lived through that, who've seen it, has been really important because we understand the fear of going to a doctor that doesn't speak English. We respect that voice, and we empathize with it and create the material necessary, or help come up with the solutions. Some of the resources we have been using to support our work are, again, going with our communities where they get their information. Facebook has been really important, especially through the pandemic, when the community wasn't going out as much, or parents listened to Facebook. That's where the the fake news were spreading. We went there, and that's why we've created this weekly segment, community event, local trusted voices, local health department, local health clinics. We have some Latinos who are leading these health clinics. We're part of them, and they also help us spread the information and also gather what we need to create in order to meet the needs of the community. Local doctors, local trusted Latino organizations that collaborate through the KLAC stakeholder efforts. So the COVID-19 stakeholders is created from Latino leaders, Latino organizations that serve our community directly. So we go where the people are, where they get their food, where they get their medical care, where they get anything they need from the day-to-day grocery stores. And local Spanish media has been very important. Some lessons that we have learned, we need to work on marketing and communication and barriers at the same time. It's a multi-pronged approach. If we communicate the importance of a vaccine, but people can't get it, then we're not doing enough. As we are a statewide organization, we haven't done as much from door to door, as I said, but we're starting because we realize that that marketing is not enough if people still cannot understand how to get the vaccine, where to go, and so forth. If there are barriers that prevent them from signing up. We have to meet the community where they're at, in their language, with their with voices they trust, at their neighborhood, at their job, go meet them where it's comfortable for them. A one-size approach doesn't fit all. So we must be flexible, and we need to be empathetic, and we must listen and respect the voices so we can understand the barriers our communities are encountering and create those projects that will help get through the barriers. And we must collaborate with and listen to local leaders to respond to issues and create solutions and work together with them. How can we do more of these? We need more vaccination clinics in Latino neighborhoods. We need some other things that are preventing the community from getting the vaccine are locations that might be asking for health insurances or IDs because the community gets scared and leaves. Bilingual process to sign up for the vaccine, more vaccine locations, a process to sign up in Spanish without a computer. There are people who just don't have access to internet or transportation. Access to vaccines and clinics after work and on weekends. Funds for bilingual and culturally relevant ads in Spanish media, local events in vulnerable neighborhoods where information is available in Spanish, access to internet, which I know it's broad, but it's so imperative to sign up for the vaccine, and really not everyone in our communities of color has it. Communicate vaccine locations that are through trustworthy sources, and also make sure that the locations are trustworthy for the community because they are afraid. And we must respect those feelings and meet them where they're at. Just because we might not have it or somebody else might not have that same feeling of fear doesn't mean their feelings aren't valid. So we really have to, again, the theme is the respect of voices of color and really letting them lead the conversation to collaborate and create solutions, and increase culturally competency at local vaccine sites to ensure our communities feel welcome when they're getting vaccinated.
Great, thank you, Alde, so much. KLAC has really done a lot of amazing work under your leadership, really meeting people where they are across multiple platforms in a culturally relevant way and in their language. So thank you for sharing that. So last but not least, we'll hear from Martha Gabehart, Executive Director for the Kansas Commission on Disability Concerns. Martha has been the Executive Director of the Commission, or KCDC, since 1991. She has knowledge and experience in architectural accessibility, disability, anti-discrimination laws, assistive technology, emergency preparation for people with disabilities, and workforce development. She is currently a member of the Assistive Technology for Kansans Project Advisory Committee, the Governor's Commission for Emergency Planning and Response, the KU Architectural Accessibility and Integration Committee, and the chair of the National Association of Governors Committees on People with Disabilities. She is a certified public manager and has a master's in public administration from KU. Over to you, Martha.
Thank you. My presentation is going to be a little different from others because disability is non-discriminatory. It's a part of being a human being, and we're all just an accident, illness, or aging into a disability. So you're going to be welcomed into the group at any time. So any group that you are targeting to present a message about vaccination is going to include people with disabilities. So actually, you're kind of doing my work for me. You should, when you do your planning, plan for communication and make sure that you include written materials in large print. If you provide large print, or if you provide written things, make it large print, that 16-point font. Also, you should use plain language for all communication. That's not dumbing down your message. It's bringing your message into language that the common person on the street would understand. So try not to use acronyms, try to use fewer syllables. We all use very technical terms in the government. Try to make this easier for people to understand. If you use social media, commercials, public service announcements, you should have captions. You have somebody who speaks, an audio description, if you have any action on the screen. So captions, a lot of people who are hearing impaired or deaf don't know sign language, and the captions help them. If there's someone speaking, then if there isn't someone speaking and you just have words on the screen, then all your blind and visually impaired folks are not going to get your message. Also, audio description helps people who are blind know what's happening on the screen. Next slide, please. So people with disabilities can have mobility impairments too. If you're using federal money, any kind of government money, actually, this is not an ADA or Americans with Disabilities Act presentation. You've got to make sure that everything you do is accessible. So government money equals access for people with disabilities. Accessible meeting places should be a priority so that all are welcome to participate. So if you're holding a meeting and you're inviting people in, make sure that that building and area are accessible, and then advertise that. Government buildings and public service providers are usually accessible. Libraries, local agency offices, area agencies on aging. If you're not sure, ask if there is accessible parking and an accessible route from the bus stop and parking to the accessible entrance. If there are accessible restrooms available, ask where the accessible entrance is, and it'll be one with no steps or will have a ramp. Next slide, please. If you have invitations that you're sending out or flyers, and you need to make sure that you ask or put down that if people need large print, braille, interpreters, or captioning to participate in your meeting, have them let you know 3 to 5 days prior to the meeting so you can make arrangements. If you don't have that message on your invitations, then you have to make sure that you have large print, braille, interpreters, and captioning available. So ask them to tell you, unless you want to go ahead and foot the bill for those extra things. If you need a sign language interpreter, the Kansas Commission for the Deaf and Hard of Hearing can provide a connection to sign language interpreters. They'll help you find one, and that phone number is there. Captioning, you can Google captioning, and there will be captioners all over the place. So if you need help, let me know. My number is at the bottom. If you need Braille, my website has a list of providers on that, and that link will go to the list. If you don't know what to do, reach out to me, and I'll see if I can help you figure out what you need to do in order to be accessible. Next slide, please. So only 1% of people who are blind read Braille, and that's because those folks learned Braille in blind school. They don't teach Braille in public schools. So you need to include on your announcement that they need to request Braille if they need it. If you're just showing up at someone else's meeting and are sharing written materials, you need to bring a copy of Braille with you and a few copies in large print. If you're providing food, be sure to include a note about special dietary requirements. That's going to be a disability that you'll need to be prepared for as well. If someone needs a sign language interpreter, do not rely on a family member or friend to interpret for them. You need to contact the Commission for the Deaf and Hard of Hearing and get an actual sign language interpreter. Next slide. So you need to make this your standard operating procedure. You need to have that statement about requesting large print, Braille, captioning, and sign language interpreters on your flyers and meeting announcements. Always include accessibility of the meeting place in your search for a place to meet. Then include a statement that the event will be at an accessible location in your meeting announcement or flyer. Always include a note about special dietary needs in your registration or announcement that mentions snacks, treats, finger foods, appetizers, that kind of thing. Give a contact number or email so they can notify you of their needs. Next slide. Is that it? Nope. Yes. Okay. So ready for questions.
Wonderful. Thank you, Martha.
Mm-hmm.
I always feel like I learned so much whenever I hear from you. So I think the 4 presenters today really had great examples of how to meet communities where they are. And I'd love to hear from others of you today during the discussion about how you can see this kind of playing out in your own communities. So at this point, I will have our discussion and I'll turn the floor over to our KU facilitators, Vicki and Shirley.
Thank you, Dr.
Vicki, if I could, or Dr. Garcia, if I could. So I want to make one additional point, and that is that will work for all of us. My good friend, Ed O'Malley is on the call, and the KLC has a journal that they put information out. And I've just posted in the chat one of the journal articles that KLC put together because of a death that happened in our community. But the beautiful thing is, as you look at that article, it not only included folks like myself, but also Dr. Erin Corvo from the health department, Mariana Ramirez from Juntos, and it brought together all of our groups to discuss that one particular death. So I wanted to put that out there and give my good friend Ed a shout out.
Thank you, Broderick. That's really nice to hear and appreciated.
Yes, thank you very much for that. Everyone, hello. This is Shirley Orr. I'm a consultant for the KU Public Health Practice Program, and I'd like to help lead off our conversation today. As I listened to our speakers, I was really struck by the vast knowledge, range of expertise, and really deep community awareness, involvement, and connections that we have within our COVID. And that's critically important because as we move forward, we really want to raise and elevate these voices who can speak not only for their organizations, but for those populations they serve, so that we can take all that information and use it in crafting not only recommendations for how we move forward together, but also in specifically making those linkages and connections and looking for opportunities to better do this work all across the state. So in the next few minutes, what we are hoping to do is to give all members of the COVID a chance to provide some input, some initial thoughts, reactions. Would love to hear from you. What do you believe or see as some of the critical common themes and concerns? How can we work better together to go to where the people are, including how can the COVID support and amplify all of this work? So just a reminder again, what you heard was a very high level discussion about a lot of work underway. And it's very likely that in the future, we may want to go back and do a deeper dive on all of this information. But for today, we thought it important that you have a base level of awareness about these 3 particular program areas, communities, and areas of concern. So for the conversation, likewise, please, if you would, try to keep your comments very focused and high level, but we want to give an opportunity for everyone to come forward and share as they would like. So with that, I will open the conversation for all and any members who'd like to speak to any of these issues that you see appearing before you.
This is Virgil Watson, might say just 1 or 2 comments. Those of us in smaller communities don't have access to some of these programs in our rural areas and some of the resources that are available. So I find it helpful to see what the metropolitan areas are doing, but we're more face-to-face, one-on-one, grassroots is what we're doing or have been doing. And our effort has been stymied some because the vaccine is readily available and we're missing that movable middle piece right now. And those that were hesitant that we probably will be able to get if we just had the right communication techniques to get them. So I find this very, very helpful. But we had a meeting on Monday with Mary Ricketts, and she has informed us that there are some micro grants available to help. And maybe Dr. Garcia and Jacob might be able to pre-screen a meeting with her, and then maybe we could invite her to come and join us in one of our next Zoom meetings and give us a short presentation.
So a need you're identifying is to be able to adapt and adopt strategies that are relevant and appropriate for under-resourced communities. Is that an accurate capturing of what you've shared?
Great summary. Thank you.
Thank you.
You know, one of the things that we've discovered in our work in various areas is that, and I think Audie made mention of it, and hope I'm saying her name right, but we found that one size doesn't fit all. You have to be flexible. Broderick mentioned it. You have to be able to be nimble and able to adapt from time to time. And I think Brother Virgil will find that that's going to be applicable both ways. And so we have to be flexible and willing to adjust to make sure everything works. Thank you.
Reverend Carter, would you be willing to say just a little bit about perhaps some of the things, some of the tools or resources that help you to adapt those strategies as you found that necessary?
Well, one of the things, initially, we knew that in the African-American community, for instance, we knew that most of the churches would listen to their pastors. And so we were able to engage pastors to help us with the testing, with the vaccines. Sometimes the locations, Salem, for instance, we're kind of landlocked around us. And so it wasn't a main thoroughfare. So we suggested that we go to the churches that were located where there were main thoroughfares. The Oak Ridge Baptist Church, for instance, is on Parallel, which is the main thoroughfare from the Legends area to downtown. And so there's always traffic. So that turned out to be one of the adaptations we had to make sure that we got more people access to testing and eventually to vaccines as well. So they're just a vast array of things that fit. We went out to Garden City, Kansas, and things that we were doing in Kansas City, Kansas didn't fit the same model in Garden City. And so it just depends on where you are. What was working for us during the fevers and so forth in Dodge City, for instance, they had a run on Tylenol because the workers there didn't want to be sick, didn't want to have a fever. And so it got to the place that they stopped testing even for the fever because that was not working for them. So you just have to be nimble and ready to adjust at a moment's notice to do what's best for the community as a whole.
Thank you for that very good example, Reverend Carter. And I think we have a comment from John. John, please go ahead.
Yeah, I want to follow up real quick with Dr. Carter. So can you say a little bit more about the role that you play as champion? I think a lot of us who are in the predominant culture don't really appreciate the importance of having champions at the ready, and the availability that you have and the depth of your understanding of some of these issues are critical. Just your description of trying to take it out of an urban, densely populated area to a more rural area, I think are really critical aspects that some of us are just think, well, you just transfer it over and it's the same thing, and it's not. And yet at the same time, I think your role that you play, knowing how hard it is already, can be a really important consideration. So would you say a little bit more about how the role of a champion in those minority communities, which many of you represent, is so important for what we're trying to do?
Well, I guess I was, to some degree, my involvement with the state convention and the district association where I serve, I'm already known. And so I could actually go to these communities out in Garden City and Crawford County and Sedgwick County because I already knew people there, already have relationships. And I think all of us, irregardless of where we are, what our idiosyncrasies are, we have to take advantage of the networks and the people we already know, and also be willing to build new relationships. I think Broderick Crawford and I didn't know each other before we started being involved with Health Equity Task Force. But I can say without a doubt that he is one of my best friends, and I've been able to build a relationship with him, as well as some of the clinical people, Dr. Alan Greiner. I think it's about building relationships and being open to and listening to people no matter where they are. And again, the context of that for me worked better because I knew people in all of these different pockets. And so, and I'm not afraid to say what I believe. I think we're here together, and we have to learn to work together in order to solve the problems for everybody.
Thank you. I do have just a couple other points. One is I heard a lot of issues around moral distress, and that is affecting some of the folks who are doing the outreach. I do want to offer the opportunity. We do have some folks who are now national and known faculty who can talk about moral distress and resiliency and the importance of being able to do that. That's a workshop we're going to be recording, and we could make it available, or the faculty available. So that's one thing. I did have a question for Audi and maybe Erica related to the Catholic presence in those communities, the Latinx communities and Hispanic communities in the dioceses across the state of Kansas in terms of their response. I think it's absolutely phenomenal what Tony and Broderick have shared with us, but I didn't hear a saint anything in that group in terms of the Catholic Church response. And I know that there's a lot of that that's, hold on a minute, sorry about that.
And I mean, there's just so much to cover. It was hard to cover absolutely everything we've done over the past year, because it's been a year packed with a lot of work, but during our programming, so as we work to collaborate and build on the work we've done, and as we listen to the voices across the state that are Latino, we did the issue with Catholic and really in religions in general, being people in different religions being afraid of taking the vaccine, thinking that it was not good for their religion. We found that the Catholic Archdiocese was very helpful. We've also had some partners reach out to different clergy, especially in Southwest Kansas, because in Southwest Kansas, our Latino communities are not only Catholic, they also have other religions, evangelical religions. So they have been going out to different ones and delivering the flyers, asking how we can help, how we can get them more information. And then the next step is just making sure that we are making a summary of all the barriers to ensure that we're working to advocate to get rid of them. But the Catholic Church has been present in some of our events, and the reason was for that, to show a unified front and to create programming that was relevant for the community, and having clergy is relevant.
Thank you.
For El Centro, we've been able to host so far already 5 different vaccination events, partnering with individuals like Advent Health, SWOBE, Nurture KC, and Walgreens. These are events that 2 of them were held at our locations, one in Olathe, one at the Academy for Children. But the other 3 were actually at churches. We've done 2 in Kansas City and then 1 in Olathe. And for us, we've actually had more success working with the Christian churches. And so they've been very accepting and opening to us, coming and talk not just to their congregation, but also volunteering and having their members vaccinate during the events and then volunteering at our events. We're super excited. We've been able to vaccinate, I think at this point, over 300 individuals mostly Latinos, mostly immigrant, primarily Spanish speaking, and we're hoping to continue to be able to vaccine clinics throughout. And I just wanted to make my hand up was just a quick comment that I was going to make on this slide on how can we do more of this. I just really love that because those are literally the things that have worked for us. It's really important to have events where people don't have to pre-register, where they can register right then and there in Spanish. You have to have individuals that fill out the registration form for individuals and don't make that a barrier, just to make it as welcoming as possible. And of course, working with Spanish media absolutely has helped. Having the information on social media, having media there, kind of announcing it like an event, like a fair, helps out a lot. And so we're just going to continue to do those kind of things that have been working for us, that are bringing in the community that we're trying to target. And we hope to continue to have success.
Everyone,
final
thank
comment.
you. This has been a great, robust discussion, but unfortunately we are bumping against time. And particularly, I wanted to ask Erica, Nicole, and Jennifer, if you would please enter your comment or question in the chat. We do plan to begin issuing some midterm communication, if you will, between meetings. So we will circle back with our speakers and bring those forward so that we can have some additional input from everyone. But thank you so much. We really do appreciate a robust conversation. So thanks again. And I think at this point, Dr. Garcia will talk a little bit about next steps and where we go from here.
Thank you. Pretty sure I unmuted. Okay, that was such an amazing discussion. It really warmed my heart to have all the dialogue and hear the presentations. Thank you so much, Broderick, Reverend Carter, Ale, Martha, for those amazing presentations. And really, I really like the comment about how Reverend Carter, now you and Broderick are friends. I really feel that too, that it's all about relationships. And as I got on the call today, I did feel like I was seeing a lot of friends. So I think, you know, that does a lot to move things forward. So I really just wanted to thank everybody for the work they're doing. I really liked this format. So hopefully we'll do something similar next time with presentations so people can hear what other people are doing. Our next COVID meeting will be June 23rd from 12 to 1 p.m. We're going to send a follow-up email with notes from today's meeting, and the recording can be found on Governor Kelly's YouTube page. In addition, as Shirley mentioned, please share any updates to your work with us, and we will include a newsletter that we're going to start to send out between the COVID meetings. So with that, I just want to say thank you. Have a good Memorial Day weekend and hope to see you in June.